How many participants do we expect usually?
Usually, currently 45 have joined, ma'am.
Yeah.
I
47
think
now.
we begin.
So we
Meanwhile,
expect
others would join.
Okay. Fine. We can start.
Okay. So good evening all. We are here to the second edition of Tenacious Tuesday teaching. The topic for today's discussion is mental status examination, explanation with demonstration. And the chairperson for the today's will be Dr. Parag Shah sir. Sir is a MD and DNB in psychiatry. Sir is a currently a professor and head of the Department of Psychiatry, uh, Municipal Institute of Medical Education Research, Surat. Sir is also the zonal representative to IPS West Zone from 2021 to 2024. Sir is also the EC coordinator in IPS Institution Subcommittee and School and College Mental Health and Community Psychiatry. Sir is also president-elect of Indian Psychiatric Society South Gujarat branch. Sir was ex-president and ex-editor of IPS Gujarat branch. Sir is also an associate editor in Annals of the Indian Psychiatry. Sir has been MD and DNB PG examiner and NMC and DNB assessor. Sir has 30 publications in his name. So now I would like to uh, hand over session to Dr. Parag Shah sir and introduce our speaker Sushil Gawande sir.
Thank you so much, Dr. Sachin. It's my pleasure to introduce Dr. Sushil Gawande, a very good friend of mine, a wonderful person, and a psychiatrist from Nagpur. I know for so many years together. Dr. Sushil Gawande is currently working as professor and head of Department of Psychiatry at the MKP Salve Institute and the Mangeshkar Hospital in Nagpur. He is the president of Psychiatric Society of Nagpur in 2021 to 22. He has been the chairman of Art and Cultural Task Force of IPS West Zone branch, and he has, to his credit, the gold medal in all psychiatry exams throughout his career in MD, diploma, and so for the publications, he has more than 30 publications at national level and 7 at international level. Books written on interesting topics of techniques of positive thinking, cyber psychiatry, and he has also authored chapters in various books, including the textbooks which are published in Pune, a lot of non-academic books related to psychoeducation in other areas. One of the areas that I remember of his interest is art, culture, and music. He's an editorial board of the eminent journals in India. He is also a team member for IPS guidelines for the screen use. And as I said, among his hobbies, we all know in Indian Psychiatric Society throughout India for him as a great person who is fond and loves music. He has composed various songs and is a well-acclaimed flutist and is also involved in drama, which he has written as well as directed. So we have a psychiatrist, we have a literary person, we have an artist, we have a musician, and a wonderful human being in front of us for the next 1.5 hours to share his experience and expertise on the topic of mental status examination. We welcome you, sir, on this forum. We are all very excited. All the PG students and all the faculties present here welcome you wholeheartedly. The session is yours, sir.
Thank you, sir. Thank you so much. Thank you so much. Hetvi, can you switch on your screen? And Shruti too.
Yes, sir.
Yes, Sachin, we are visible on your screen. All three of us are there.
Yes, sir.
Okay, okay. On your screen also, Shilpa ma'am.
Yes, but three of you have to be in a grid, right?
Yes, sir.
That is not there. I can see right now only you. And
Okay.
Shruti and Hetvi are on top.
No, that's fine. But three of us are visible at a time, right?
Yes.
Yes. Okay.
Not
So-
in a grid, but maybe Yogendra can help
Yes.
in this, Sachin.
I
Miss
think if all the three of you are live on the camera, as in when you are when you are going to speak, obviously you will be coming on the main screen when your voice is being recorded. So it would be rotating, your screens would be rotating, even if we can see one at a time.
Okay. Fine. Absolutely fine.
That's how you want it?
Person who is speaking will
I
be
want
visible.
all three of us together on the screen.
Yeah, so that's what I was suggesting, that Yogendra could help in that.
Right now, probably it is spotlight on the speaker. If that
we could
can
get
be
all
changed,
three.
all
everybody
three.
can see.
I will
it.
give on all three. Spotlight.
Yeah.
Spotlight.
Yeah.
Shruti is getting conscious. Spotlight on her.
Yeah.
Is that okay, Yogendra?
Now.
Yes,
Yeah.
yes. All three of you are there.
Yes. So I'll start, ma'am, with your permission.
Yes, sure.
So, good evening to all the participants, students, as well as office bearers of this Tenacious Tuesday meetings. First of all, thank you so much, Shilpa madam, for giving this opportunity. It's again an area of interest to interact with the students and talking on a very, very basic topic of mental status examination. My special thanks to Parag sir for my introduction. You are very, very liberal whenever you get opportunity to talk about me, and thank you so much for that. Friends, I won't talk much. As Sachin rightly explained, it is mental status examination, explanations with demonstration. So before we go ahead, let me explain you our plan. So here, Hetvi is an examiner. She would interview Shruti. So Hetvi, please say hi.
Hi, sir.
Yes. And Shruti, please say hi. Yes. So, Shruti, you are not audible.
Sorry.
Yes.
Sir, am I? Oh,
Yes, fine. So, mental status examination is not a very difficult topic, because as soon as we enter into psychiatry, that is the first topic, and we live our entire professional career taking mental status examination. But when we are there as a student, we have a different dilemmas, and when we are there as a teacher, we have a different dilemmas. The moment you cross one college and go to next college, you will find some change in the format of mental status examination. The moment you cross one state to other state, you will find mood is going down and there is no affect. Or if you travel to some other state, you will find cognitive functions are mentioned differently, and consciousness is not there in the beginning. So many dilemmas are there. And I remember my days as a student, we used to struggle a lot where to put a particular thing, circumstantiality, in a speech or in the stream of a thought. Poverty of content was always a confusion, whether to put in a stream of thought and whether to put in a form of thought or in the speech of thought. So there are some gray areas in the mental status examination, and I think individual variation is there. when I discussed this matter with Shilpa ma'am, and she's told me very important thing, don't get involved into the format speaking. Means let's ignore that, because what is important is elicitation of mental status examination. The demonstrations are more important than the format. So we are keeping it very, very flexible. So Hetvi will take mental status examination of Shruti, and slowly we will discuss. Wherever possible, we will do demonstrations so that it would be easy for the students who are attending this meeting. And wherever possible, wherever there are gray areas, I will give my explanations. Right in front of me, chat box, I have opened it. Wherever you feel anything to comment upon, you can put your views in the chat box so that we can include those areas into our discussion. So Shruti is basically acting as a dummy patient. She is a case of long-standing hypochondriasis, and currently she is into a major depression. And she belongs to a small town. Okay, her mother tongue is Hindi or English. She speaks Hindi and English together, and she is visiting psychiatrist Dr. Hetvi, and Dr. Hetvi is talking to her. So now you will find lot of mistakes in the MSc. So that I take a responsibility for the mistakes done by Hetvi, because she will be doing mistakes deliberately to make the discussion more open and to give a scope for a demonstration. So that is one. You will find the patient very, very cooperative. Again, the responsibility goes to me because I have prepared her like that. So Hetvi has already taken mental status examination of the Shruti. She will go ahead with her MSc, and then after one part, I will stop her and we will discuss. So keep your fingers also ready to keep something in your chat box, as well as we will enjoy this 1.5 hour session. And those who are doing some other task and at the same time attending this meeting, just for 1 hour, forget about all whatever the activities you are doing, because we are not going to learn something. Apart from learning, it's an infotainment. So we are going to enjoy this session of mental status examination over here. Okay, so Hetvi, are you ready?
Yes.
My request, Shruti, keep your speaker on throughout, because we
Yes, sir.
interact. Okay. So, okay, Hetvi, go ahead with your mental status examination. One more disclaimer. Mental status examination as standalone has no meaning at all. So mental status examination has a meaning when it is associated with the history. Okay. So when we are taking history and then we are taking mental status examination, then it has some value. Otherwise, diagnosis only on the basis of the mental status examination is not a complete diagnosis. So mental status examination is a part of psychiatric assessment, and the major part of a psychiatric assessment is history taking. Okay, go ahead, Hetvi.
So I'll directly start with MSc only.
Yes.
So the patient is conscious, oriented to time, place, and person, sitting on a chair and dressed in home clothes. The patient is adequately groomed. She is sitting with hunched shoulders, with gaze and head downwards, and her age seems appropriate to the history. The attitude of the patient is cooperative. The rapport was established with difficulty, and eye-to-eye contact was initiated and intermittently maintained. So should I go ahead?
No, we will wait here. So anybody has any comments about these, please put in the chat box. Okay. So anyone has anything to say? Or do we require any modification in this part? That's general appearance and the behavior. This was the first part of the MSc. You may put in the chat box. Okay, so Hetvi, my question to you, see, you have started with the orientation in time, place, and person. And usually orientation comes under a cognitive functions of the mental status examination. So how wise it is to include orientation in a general appearance and the behavior?
Sir, because a lot of times in general examination also, we check orientation of the patient before the assessment of MSc. And if the patient is oriented to time, place, and person, then only we can mention about the attitude, whether it is cooperative and whether rapport could be established.
Mhm.
Otherwise, if the patient is not oriented, most likely the patient will either be agitated or into some form of delirium, and the
Mhm.
MSc conducting an MSc would not be possible.
Yes, yes. So very right, Hetvi. But
We have some questions in chat box.
pardon, Sachin?
We have some questions posted by
Yes, yes,
participants in
yes,
chat box.
yes.
So
I'm following
Chintan
that.
has asked, should we mention about the body build?
Yes.
Because she has not
Sachin,
mentioned.
I'm following that. They are right in front of me. I will include that also. Yes, some chats are there. Psychomotor activity would be a second part of Hitvi's presentation, MSc. And yes, she did mention about the grooming. Now the question is, see, in many institutes, consciousness comes first. Okay. And in some of the institute, even the orientation comes first. Okay. But there are so many institutes where they include consciousness and orientation under a cognitive assessment or a cognitive functions assessment, and that is not there. And I would say large chunk of the institutes are there where consciousness comes because unless someone is conscious, we can't go ahead with the mental status examination. So though it is a part of cognitive assessment, there is a general consensus. There is a general consensus to involve or to put the consciousness in the beginning of mental status examination. And it is understandable because unless somebody is conscious, we can't go ahead with the mental status examination. When I was doing my post-graduation in NAIR, so I think maybe the same pro pharma is there. So that time, all those legendary psychiatrists who were working in a corporation hospitals, they kept orientation, consciousness, and even attention in the first part, in the beginning part of the mental status examination, again with the same purpose that unless someone is a conscious, we can't go ahead with the further mental status examination. So there could be two explanations. You, with the general consensus, we can start, though consciousness is a part of cognitive function assessment, we can include consciousness in a general appearance and the behavior pattern. One thing. And orientation we again can, it's individualistic and institute to institute it may change. You may put orientation here or you can put orientation in the cognitive assessment, but yes, general consciousness can be included here in the and there are some in the chat box. I am reading that yes, psychomotor activity would be commented, and yes, when orientation is fluctuating, still we can definitely talk about appearance. So let's have a general consensus that yes, consciousness should be in the beginning. Orientation can be here or can be there in a cognitive assessment also, because we can if the patient is delirious also, maybe with the different, if somebody is uncooperative with the Kirby's pro pharma, we can have a mental status examination. In organic cases also, if the patient is disoriented, we still go ahead with the mental status examination. So orientation is not a compulsory thing here. We can go ahead. Yes. Did you notice any physical mass, tattoos? Now, Shruti, you don't show it now, okay? In a chat box, somebody has written, but yes, if we notice some visible marks, hesitation marks, suicidal marks, we can mention in a general appearance. And I hope it is taken into consideration that such marks are not there on Shruti's body. That's the reason Hetvi has not included in the general appearance. But yes, it's very, very obvious. And as you very, very rightly mentioned, so Hetvi, we will go again with your flow. Start
Yes.
general appearance. Huh.
Yes. The patient is conscious, oriented to time, place, person, sitting in a chair, and groomed in home clothes. The patient is adequately groomed with position of hunching of shoulders is present with gaze and head downwards, and the
Okay.
age seems appropriate to what is mentioned in the history, and no visible scar or tattoo marks or any hesitation cuts present. Then the attitude of the patient is cooperative. The rapport was established with difficulty. Eye to eye contact was initiated and intermittently maintained.
Yes, yes, yes. And I am very happy with the comment given by Ajinkya Gogre that if there is patient is having RT or police in situ, so we should be able to mention that also. So if someone has a RT in situ, so that would come under MSc. So just little shift from this explanation. So Hetvi, has you because you have mentioned orientation here, we will
Yes.
take a little demonstration of the orientation. How do you check for the orientation? Shruti, are you ready? So
Yes,
guys, let's concentrate on the questions put by the Hetvi for orientation assessment. Okay, go ahead, Hetvi.
मैडम आप मुझे बता सकते हो
You
कि
you can
अभी
call her Shruti. You can call her Shruti. Okay. हाँ.
आप मुझे बता सकते हो कि अभी कौन सा साल चल रहा है
2023
और कौन सा महीना चल रहा है,
दिसंबर का महीना।
और अभी मुझे अंदाज से बता पाओगे कि अभी मौसम कैसा है?
थोड़ी ठंड है अभी, घर में बैठे हैं।
मुझे आप बता सकते हो कि अभी आप कहाँ बैठे हैं?
अभी मैं अपने कमरे में बैठी हूँ,
Okay,
चेयर और टेबल पे।
Hetvi, we will stop here. So first you talked about orientation of the time.
Yes.
Right. So orientation of the time you talk about साल कौन सा चल रहा है, and then you what did you say after that?
Month.
महीना
महीना कौन सा चल रहा है? Okay, and then what was the third question?
So season.
Season. Okay, if someone answers it well, okay कि 2023 शुरू है, winter शुरू है, season और ये month December है. Okay. Can you be sure that that person is oriented in time with these three questions?
So we can further ask about the date and the time to be specific.
Okay, in these five categories, okay, year, month, season, and you are saying what? Date.
Date, and time.
Date. So which is most important in the orientation?
Sir, basically the date and the time is the most important.
Date and time. Okay. If you want to again narrow down your assessment, which is most important in this, even in a date and time?
Time.
Time, yes. So the most important would be at this moment of time, cross-sectional, at this moment of time. So what do you think? Look at the windows. Okay. What is your guess? So, and if someone is oriented and that time is also, if there is a variation of 2 hours, okay. If suppose there is a 2 o'clock and patient is telling around from 12 o'clock, 1 o'clock, 2 o'clock, 3 o'clock, even a 4 o'clock, if 2 hours of variation is there, still it is taken as person is well oriented in time. So yes, but when patients are there in the hospital, we need to check this time as more important. Date may not be that important, because if someone is admitted since 3 days, okay, so remembering the date becomes very and even normally also if we are on a vacations, you must have experienced this. If we are on a vacations, okay, for 4 or 5 days, in between, if someone asks you the date, we often fumble, okay, because at that moment of time that is not important, okay. But even if we are on a vacation and if someone asks, look around and tell me the time, we are more correct in that. So
Yes.
asking time is more important. So narrow down the thing, asking time, look around and tell me the time is more important orientation. Then yes, to collaborate it and to have an additional, then you can ask, okay. So asking again a date and day would be a very difficult for the patient. Rather, we may ask, since how many days you are here? Okay. So that can give you a rough idea how oriented, since how many days you are admitted here. So that could be the question for right questions for assessment of the day. Okay. And then season, you can, no problem. Season and the year would be there. But these two pet questions you can just mention in your register. Look around and tell me the exact time, since how many days you are admitted over here, and then season and year could be there in the orientation of the time. Second place, yes, go ahead.
आप मुझे बता पाओगे आप अभी कौन सी जगह पे है?
अभी तो मैं अपने कमरे में हूँ, हॉस्टल में बैठी हूँ।
ठीक है, और मुझे बता पाओगे आपका हॉस्टल कौन से एरिया में आता है?
हाँ, ये आता है हिंगना रोड पे, नागपुर में।
शहर नागपुर है। और आप
हाँ।
राज्य बता पाओगे?
जी, महाराष्ट्र।
और हम कौन से देश, महाराष्ट्र कौन से देश में आता है?
भारत।
ठीक। और आपके साथ जो बैठे हैं आप उनका नाम बता पाएंगे मुझे?
जी, मेरी रूममेट है
Here again,
मृणाल
Prithvi,
नाम।
I would like to interrupt you. You are checking orientation as if we are checking MMSC, okay? Because in MMSC, we need to score, okay? So now in MSc, if you are very sure that person is very, very well oriented, okay, very conscious, okay, even a single answer, okay, I am sitting in my room and this is in a Nagpur, okay, that would be sufficient, okay, because the questions are going in the flow of mini mental stress examination, okay. So place, then floor, then city, then state, and then country. So if someone is okay with the place, okay, asking her for the country, it would look very prototypical, okay, rather than it is a clinical need. So go with the clinical assessment, and if she's okay with the place, we need not to ask so many things. If she's not okay with that, yes, then you can ask all those questions. Yes, person.
Sir, the roommate, and we'll ask about like the person interviewing.
Okay. So ask Shruti about the person, orientation per person.
आपके बाजू में कौन बैठे हैं आप बता पाएंगे उनका नाम?
हाँ, मेरी रूममेट है, जूनियर मृणाल है।
Brunal. Is that okay, Hitvi? Person?
We'll like the cross check that with the
Yes,
roommate.
yes. So for a person, we need to cross check. In a place, if you are asking her address of her home, we need to cross check. Then only it is okay. So we need to cross check. So that's about the orientation. Let's go ahead with the second part of the mental status examination. First,
Yes.
general appearance and the behavior. Second.
So the psychomotor activity of the patient is retarded.
Okay.
The speed in speech, the speed is slow,
Acha,
and the voice.
why do you feel that psychomotor activity is retarded?
So because whenever, like before the mental status examination, we have observed the patient throughout while taking history taking as well, and during the mental status examination, like the spontaneous movements and the whenever the patient talks to the relatives or the interviewer, the overall movements and the overall spontaneous acts are decreased than what we would expect in a normal individual. That is why the psychomotor activity was mentioned to be retarded.
Retarded. Okay. Well, we can go ahead with next point. Yes.
The speech in speech examination, the speed was slightly slower than the normal individuals, and the pitch was monotonous, and there is decrease in the verbal output.
Okay. What else would you like to comment in speech?
Sir, in speech, we can say whether the person is adequately audible or adequately not audible. In quality, we can mention whether it is soft or very harsh, or if the patient is having shouting.
You mentioned about the three findings in the speech. What were they?
Sir, speed to be slow, then pitch to be monotonous, and is in the verbal output.
Verbal output is
Decreased.
Decreased. Three things you have mentioned. Okay. If participants, if you have anything to comment, you can put in a chat box. Okay, regarding the speech assessment. Okay, so speech is a very important aspect of mental status examination, because yes, we need to mention about reaction time, important, Ajinkya, spontaneity, yes, reaction time, Kruti, tone, tempo, Revansh is surprised. Why did you mention only 3 aspects? Speech output, tempo, tone, reaction time. Sir, we used to do rate, tone, volume. Okay, Shweta has said. Okay, fine. If anyone, relevance and the coherence, very, very important, Vineet. Hats off. I was waiting for that comment, Vineet. Relevance and the coherence. Coherence is important, very, very important. Prosody is also important. Yes, coherence is a part of comprehension. Prosody of the speech, very, very important. So I will go. Yes, speech output. Yes, fine. So now we have many. Even the participants are they are giving their inputs. We have many things to cover. Okay, many things to cover in the speech. In not all cases we talk about everything, but when we get some positive findings in the speech, then we would like to talk on the variety of the subheadings of the speech. Now we will go ahead with one after another with the one very simple thing. First is how to ask question for the speech assessment. So let's see that first, then we will go ahead. Okay. So over to you, Hetvi. Assess the speech of Shruti.
आप इधर हमारे पास दिखाने आए हैं, आप मुझे थोड़ा आपका प्रॉब्लम बता सकते हैं?
मैडम
Okay.
प्रॉब्लम ही प्रॉब्लम है.
Okay, Shruti,
बहुत-
patient Shruti, just hold on for some time. Okay. Okay. Anyone can add? Hetvi's question is a right question or a wrong question? Does she require any modification? Yes, in the chat box. She said, Shruti, आप कौन सा आप हमारे पास आए हैं, आपके प्रॉब्लम के बारे में आप क्या बताएंगे, right? Something you said, right? Tell us
Yes.
something about your problem. So any Shweta, Chintan, Kruti, anyone wants to add something? Do you want to modify the question of Hitvi? Yes. Yes. Question. Yes. Fantastic. Nrupa and the Shweta. Yes. So Hitvi, Nrupa and Shweta, they are very, very clear, and I am also the formation of the question when we ask for the speech should always be open-ended. Okay. And the formation of the questions while assessment of thought, I will talk about that later. But when we assess the speech, the question should be open-ended, right? Now, आप यहाँ पे आए हैं, आपके प्रॉब्लम आप हमें बता सकेंगे आपके प्रॉब्लम क्या है? The answer could be नींद नहीं आती है, भूख नहीं लगती है, उदास लगता है. Okay. So this is absolutely inadequate question for the assessment of the speech. So we need a open-ended question for the assessment of the speech. So Hitvi, modify your question and ask to patient Shruti.
आपको आज कैसा लग रहा है?
Again, the answer would be Hitvi, अच्छा लग रहा है. This is not a open-ended question. Can someone suggest Hitvi any open-ended question to be asked to Shruti? In the chat box, you can chat. Yes, Priyanka has suggested. Okay, Priyanka Chaurasia has suggested. How is life going on? Okay. So ask this question to Shruti. Okay. Hetvi, go ahead.
आपकी लाइफ कैसी चल रही है?
मैम वैसे ठीक है, पर तबीयत में जरा थोड़ा डाउन लग रहा है, अभी ठीक नहीं लग रहा है.
Okay. So this is an open-ended question. So open-ended question could be like this कि आप जो जगह से है उस जगह के बारे में हमें बताइए, है ना? आप कॉर्पोरेशन में काम करते हैं तो आपके काम के बारे में हमें कुछ बताइए. ओके. आपके हॉबीज के बारे में हमें कुछ बताइए. आजकल आपकी जिंदगी कैसी चल रही है उस बारे में हमें आप बताइए. ओके. So anything, yes, tell us something about yourself. So open-ended question. Why do we need open-ended question? Because for the assessment of speech, we require a larger speech sample. If the speech is monosyllabic, okay, if the answers are with the single words, then assessing the speech becomes a problem. So we want a good speech sample to assess the speech. Okay, so we will assess this speech again. So my request to Hetvi, ask 2-3 open-ended questions to Shruti, and then we will go ahead with the assessment.
आप क्या काम करते हैं उसके बारे में थोड़ा बता सकते हैं?
मैडम, ऐसे तो मैं घर पर ही रहती हूँ, ज्यादा कुछ आजकल हो ही नहीं पा रहा है, घर के काम ठीक से नहीं हो पा रहे हैं, बस कर लेती हूँ करने के लिए वैसे तो।
आपको क्या क्या चीजें करना अच्छा लगता है?
अभी तो अच्छा लगना बंद ही हो गया है मैडम। बच्चों के साथ वक्त बिताती थी, उनके साथ रहना अच्छा लगता था, पर अब कुछ मन नहीं लग रहा है।
आपके फैमिली के बारे में आप थोड़ा बता सकेंगे?
परिवार में हम हैं और मम्मी पापा है और भाई बहन है सब ठीक ठीक है वैसे तो, ठीक है मैडम।
Yes, yes. So before going for assessment of speech, those who are participants, Shruti, you are acting so well. Put your thumbs and the claps in the chat box. Okay. So it's very hard to find such a good dummy patient. Okay. So see, put your hands. Okay. This is the way we can applaud for you, Shruti. Wonderful. You are doing wonderful job. And
थैंक यू सर।
we are getting a feel. Okay. So don't feel offended when I say
नहीं,
Shruti, okay?
नॉट एट ऑल
Wonderful.
सर।
So let's go ahead with the Hetvi with the speech assessment. My first question to you, Hetvi, is it wise to differentiate speech assessment from the thought? Because speech is the medium through which we can approach the thought, right? You will agree with me. Speech
Yes.
is the medium through which we approach the thought. So is it wise to divide speech assessment and thought assessment separately? What do you think?
Sir, according to me, so the speech assessment should be done first, and in thought assessment, sir, whether it is continuous, coherent, relevant, that correlates with the speech assessment. But sir, in thought, additionally, we have a lot of things.
No, my
like-
question is very clear, and you can narrow down. Very specific. Is it wise to have a speech assessment separate from a thought assessment?
Yes, sir.
Why?
Sir, in speech, we study a lot of characteristics like the speed, pitch, volume, tone, coherency, relevance, then the reaction time, the ease of speech, things like that. And in thought examination, sir, we concentrate more on the form, the content, the stream, and possession, and all those.
Okay. Fine. Even the participants, all Anushri and even Sri Lakshmi, you can put your comments. Is it wise to separate it? Because see, in many institutes, they assess the speech under this heading, thought/speech. You know, considering that speech is the medium through which we assess the thoughts. That's the first explanation. Now, second, is it extremely difficult to differentiate disorders of stream of thought from the speech? So under assessment of thought, there is first part, stream of thought. So it is so difficult to differentiate stream of thought from the speech. And that's the reason many people, they include thought and speech assessment together. So, but you feel, according to you, it should be done separately, right? Nachiketas, he said speech would be assessed. Yes, some people. But speech can give a rough idea about the thought form. Yes, speech slurring. Yes, Ajinkya. Now, maybe for few first decade of psychiatry, I was also of the opinion that yes, we can assess the speech and thought together. But right now, after 20 years, I am clear that speech should be assessed very separately from the thought. Now, as Nachiket and other people are mentioned, if we assess the speech and thought together, where can we mention about the slurring? If someone has a slurring of speech, is there space in a thought to talk about the slurring of speech? No, it's
No,
not
sir.
a thought problem. Someone said about the aphasia. If someone has a Wernicke's aphasia, which is a sensory aphasia where comprehension is affected, and because of the Wernicke aphasia, patient's comprehension is not there, and it seems that patient is irrelevant. Okay, and you know that person has a infarct in temporoparietal region, and his irrelevance, Wernicke's aphasia, is because of that organicity. So, can we mention that Wernicke's aphasia in the thought?
No, sir.
No. Okay, if we have an anxious person right in front of us, and if he is very anxious and he is stammering, okay, or he's stuttering, can we mention that stammering and stuttering in thought?
No, sir.
So there are so many areas. Okay, aphasias are there, slurring is there, stammering is there, stuttering is there, uh, pressure of speech. So many areas are there. They have no place in the assessment of the thought. Yes, Ajinkya, yes. We will go with that answers also. They have no place in the thought, and that's the reason we need to assess speech separately from the thought. Okay, very separately. So now the first part, okay, now start describing the speech of the Shruti. Over to you, Hetvina.
So should I mention the points as mentioned
Yes,
previously?
point. Yeah, you can modify also. Now with
Okay.
with my inputs and with the inputs from the chat box, we will go ahead. Yes.
Okay. So the speech of the patient, the intensity was audible, the
Hmm.
pitch was monotonous, the
Okay.
quality was.
Yes, can we make some consensus about the speech? Can we start from the coherence? Because see again, unless there is a coherence of the speech, we can't go ahead. Okay.
Yeah.
So the first part will be the coherence. So
Yes.
is he coherent?
Yes, sir. The speech was coherent, relevant.
In a line, can you tell which speech is coherent and which is incoherent? In a line, what is coherence?
What can be understood?
Yes. So a speech which is comprehensible is coherent. Okay. Yes. So speech was coherent. Was there?
Yes,
Yes.
sir. Speech
Second
was
part.
coherent
Second.
and relevant.
Was it relevant?
Yes, sir.
Okay. So which is irrelevant?
The answers are not like basically there is
Okay.
no
If it is appropriate to your questions, it is relevant. If it is not appropriate to your question, it could be relevant. So first part in the speech assessment, Shruti's speech was, she was coherent and relevant. Then go ahead.
So then the intensity was audible, the tone, the pitch was monotonous, the quality was soft. Sir, then the reaction time was increased. There was increase in the reaction time. The speed was slow. In the speech productivity, there was decrease in the verbal output, and the tone
Okay.
was soft.
Okay, just Priyanka has typed what to write is only a part of sentence is coherent, like able to understand only few words. Okay. So it is quite possible that in some parts he is coherent, Priyanka, and at some times he is not coherent. So you can mention that she is coherent and at times she becomes incoherent. Okay. Coherence is your ability, okay, to comprehend. If you are able to comprehend at some time, at other time you are not. Very well, you can mention that. Okay. I got distracted with that. Hetvi, I hope you have mentioned all that. Did you mention about the spontaneity?
No, sir. The speech was spontaneous.
Speech was spontaneous. Did you mention about the reaction time?
Yes, sir. Increase in the reaction.
There was an increase in the reaction time. Okay, so we have mentioned about the tone, we have mentioned about coherence, then relevance, then spontaneity, then tempo, then reaction time, okay, and even the quality. So almost all parts are covered here in the speech. So the positive findings in Shruti's speech assessment, what 3 positive points were there, right?
Yes.
What were the 3 positive points?
So increase in reaction time,
Okay.
pitch being monotonous,
Monotonous.
quality being soft.
Okay, fine. If suppose Shruti is a patient of a bipolar disorder, mania.
Yes.
So what additional findings you could get in a speech assessment?
Sir, reaction time could, like, opposite findings would be like reaction time could be lesser, the pitch could be high.
Okay.
The patient will have more verbal output.
We often write POS present plus. What is that POS?
So planning, all that you ask, sequence and all.
In the speech assessment of a manic patient, we write POS present in the speech. What is that POS?
So the pressure of
Speech. Yes. So more pressure of speech. Okay. Some people mention about the what is reaction time and spontaneity. They're one on the same thing. Okay. If reaction time is normal, patient would be spontaneous. If reaction time is delayed, then a person would be less spontaneous. So pressure of speech would be there. Okay. Again, I don't find, yes. So, yes. So how to, okay, if pressure of speech is there, how to demonstrate that there is a pressure of speech?
Sir, again, we can ask any open-ended questions.
Okay.
At that time, the patient might have increase in the verbal output. The patient might not even stop if you want to ask another question. The patient might.
Yes. So I was taking examination somewhere, maybe last year, MD examination, and that particular student, he mentioned patient has pressure of speech. I asked, how did you assess that pressure of speech? And his question was, sir, he's speaking more than 150 words per minute. Okay, and that's why I have concluded that he has a pressure of speech. Now, it is for the research purposes, okay, that counting 150 words per minute, it is for the research purposes, right? For a clinician, okay, in a clinician's word, a simple technique to demonstrate pressure of speech means, sir, I am finding it difficult to interrupt. Okay, I am finding it difficult to interrupt. That's the enough to say about the pressure of the speech. And in a pressure of speech, the person will be very spontaneous. He would be very loud also, very loud, very fast. So those are the corroborative findings of the speech for the pressure of speech. Okay. Some people have said, sir, can we mention echolalia under the speech? Okay, see, again, these are the gray areas, as I mentioned. Echolalia, neologism, then poverty of the speech, poverty of content. These are the gray zones where they can be there in a speech as well as in the stream of a thought, even for the form of thought. So these are poverty of speech, poverty of content, then echolalia. All these things are the gray areas. Wherever you find it's comfortable, considering the entire history and entire MSc, there you can put. But if suppose you put echolalia in the thought, in the stream of thought, I don't think that you are wrong. Or if you put poverty of content in a form of a thought, as name suggests, poverty of a content, I don't think you are wrong. If you put poverty of the speech in a stream of thought, it's not a wrong. And at the same time, if you say poverty of the speech in the speech also, I don't think that is a wrong. These are the gray areas. If suppose an organic neologism is there, organic, it would come under a speech. And if it is because of the functional disorders like schizophrenia, it would come under a form of a thought, not even a stream of a thought. So according to the history and overall MSc, we can put these findings together. Okay, let's go ahead. Yes, Hetvi, go ahead.
Some mood reported by the patient is sad. The effect of the patient is restricted. The quality is restricted. It is.
Can you? Yes, mood. We will just stick to mood. Okay. Yes, assess the mood. Assess the mood of Shruti. Yes, go ahead.
आप मुझे थोड़ा बता सकते हैं अभी आपको कैसा लग रहा है?
अच्छा नहीं लगता है, उदासी
ज्यादातर
छाई रहती है।
ज्यादातर आपका मन कैसा रहता है? जैसे अभी आप हमसे बात कर रहे हैं या घर पे रहते हैं, मन कैसा रहता है आपका?
अच्छा नहीं रहता है, उदासी छाई रहती है दिन भर।
Mhm. Can we modify Hetvi your question? Means your second part of the question was okay. What do you think when we ask about the mood? Do you want to assess a cross-sectional mood?
No, sir. During MSc, we only assess the mood at that point of time.
So that's the cross-sectional mood.
Yes, sir.
Okay. First thing to be very, very clear in your mind, MSc is not a cross-sectional thing. Some of the points of MSc are a cross-sectional thing, while there are many points which are longitudinal. Okay. So mood assessment is not a mood assessment only at that moment of time. It is since last few days. Okay. Since last few days, most of the time. Okay. So
Yes.
if we modify our question, so let's prepare a proper question for mood assessment, and that would be useful for everyone attending here. So let's modify your question and then ask Shruti.
पिछले कुछ दिनों से आपका मन ज्यादातर कैसे रहता है?
अच्छा नहीं लगता है मुझे, ऐसे उदास उदास लगता है।
Perfect. So I think I will grant you 10 out of 10 marks for this particular question for asking mood. Okay. पिछले कुछ दिनों से ज्यादा समय आपका मन कैसा लगता है? Okay. So that would be a very, very correct question to ask. Okay. So what are your findings in mood?
So mood reported by the patient is sad.
Is by sad. And what is your assessment, your objective assessment?
Sir, in affect, I would say
Objectively, what do you feel? Whatever she is conveying, is that correct?
yes.
You also feel that. Okay. So sometimes it there. While asking mood, that question should be very proper. And sometimes when there is incongruence, right? If you are almost certain that patient has a depression and patient says something else in the question. Okay. So here it comes that your objective assessment would be there in a mental status examination. So suppose Shruti says that ज्यादा से ज्यादा समय आपका पिछले कुछ दिनों से आपका मन कैसे लग रहा है? Shruti says नहीं बहुत खुश लग रहा है. Okay. So if you put the verbatim, so you can say that she says that she's happy, but I feel okay. Through the history and after my mental status symptoms, I feel that's the objective assessment. I feel that her mood is sad. Okay. Yes. So go ahead with the mood. Second part. Yes. Rahul has asked Hetvi question. Can we use words like okay, okay lag raha hai, theek lag raha hai? Rahul, we have a beautiful term that is euthymia for okay. Okay. So theek lag raha hai means euthymic mood. Okay. So we are prepared for these words. So you may say verbatim, okay, she's on assessment of mood. She says, okay, so I think her mood is euthymic. So euthymic would be a proper word for this tik-tak mood. Okay, go ahead.
Sir, in examination of affect, the quality is sad, which is congruent to the mood. The range is restricted, and it is the patient's range is restricted, and it is inappropriate to the setting.
Okay, fine. So I will go ahead with only second comment of yours. First thing, before we go ahead with the assessment of the affect, Prachi has mentioned, Prachi, that I don't feel anything. Prachi, again, there is a beautiful word for this, okay, in a psychiatry. There could be a handful of patients saying, कि मुझे समझ ही नहीं रहा कि मुझे कैसा फील हो रहा है, राइट? सो दे आर डिसलेक्सिक अबाउट देयर मूड. ओके, सो हैविंग alexia to express mood has a particular terminology. Prachi, if you are there, yes, absolutely, Ajinkya has mentioned. So we have a terminologies for that, okay, and we can use all these terminologies whenever we talk about that. Now, before we go ahead, again there could be a controversy that shall we include mood separately and affect separately? Can't we go ahead with the mood and affect assessment together? Yes, yes, yes. See, the purpose is why people have divided mood and affect separately. Mood and affect is a same thing, okay? Expression of mood is affect, okay? While whatever you feel, that is subjective part, is a mood. So if we keep it together, then it becomes very difficult to assess the various aspect of the mood. If we divide it in a sub parts, then it becomes easy, and that's the reason mood and affect is assessed separately. But if some of you are comfortable in assessing mood and affect together, then there is no problem. We can go ahead with the assessment of mood and affect also together. That you are not wrong in that assessment. Okay. So, okay, you talked about reactivity of the affect. So how is her reactivity of affect?
Sir, I only mentioned about quality, range, and appropriateness and congruency. I didn't, so we have not
So
mentioned the other
in a range, what did you mention? What was your second point?
restricted.
Restricted. Okay. So, Archit, we will talk about these things also. So let's go ahead with the affect assessment, restricted. So assess, show us her affect is restricted or she has a normal range of affect. Okay. What questions you will talk?
Yes.
Put forth your questions.
यस आप मुझे बता सकते हैं अभी घर पे वगैरह कौन कौन है, आपका कोई बच्चा वगैरह है?
नहीं मैडम, बच्चे वगैरह अभी नहीं है। घर पे सब रहते हैं, मम्मी पापा भाई बहन।
बच्चे शैतानी वगैरह तो करते ही होंगे।
कुछ कुछ करते हैं आस पड़ोस वाले, ऐसे ध्यान नहीं देती हूँ मैं ज्यादा।
Go ahead, go ahead.
ठीक। बाकी घर पे वगैरह टीवी वगैरह शोज चलते रहते हैं?
हाँ, ये देखते हैं, छोटे भाई बहन देखते हैं, पापा न्यूज वगैरह देखते रहते हैं।
आपको उसमें से कुछ पसंद रहेगा ना, कुछ ऐसा रहेगा जो आपका बहुत मन पसंदीदा रहेगा, आपको बहुत अच्छा लगता होगा?
कुछ तो पसंद आ ही नहीं रहा है, ऐसा कुछ है नहीं जो
Very
पसंद आए मुझे।
nice. So in a chat box, now let's put thumbs and the claps for Hetvi for her wonderful questions. Okay. And I think Shruti, it's very difficult to shift you from the role of that dummy patients. Okay. Okay. So what was in your mind, Hetvi, while assessing the range of the affect? Yes.
So basically, in range, we generally assess whether there can be any variety of emotions that are expressed by the patient. If you ask certain questions where certain response, like when we ask about something that the patient really likes, there is generally a smile on the patient's face.
Yes.
And
Yes.
these questions also help us in assessing the reactivity, where some external stimuli is
Okay.
provided
Yes.
and we see the
So
patient's.
you were trying to lead her to humor, okay, so that there will be some smile, okay. So
Yes.
when Badmashi or Bachche, then your favorite TV serial. So by asking all these questions, normally a little bit of a smile will come.
Yes.
So you had asked, "Ghar mein sab kaise hain?" Okay, so that is one part of the question, and so we can ask this range of the question. Okay, so one questions which has a emotional tone of sadness, and extreme questions where you can initiate some humor. And normally, if you ask me कि आपके favorite hero कौन, आपकी if you ask me कि sir आपकी favorite actress कौन है, ask me.
सर आपकी फेवरेट एक्ट्रेस कौन है?
हमारे जमाने में एक ही एक्ट्रेस थी, माधुरी दीक्षित. ओके. जो फेवरेट थी सबकी. So see here, when I say that, na, Madhuri Dixit and all, I need not to mimic the smile. Okay, it would come spontaneously. Okay, so it comes spontaneously. So reactivity of the affect is so important, and among all the signs in a psychiatry, affect is so important. On the basis of the affect, we diagnose people. On the basis of the affect, we plan treatment. On the basis of the affect, on the follow-up visits, we assess whether there is enough improvement or not. On the basis of the affect, we diagnose many prodromes of the schizophrenia. On the basis of the affect, we many times assess the severity. So affect is so important thing in the assessment. And you have asked talked about the range. So very proper questions. So those participants who are here, prepare your questions the way Hitvi had prepared her questions to assess the range of the affect. Yes. I think someone has also talked. That was your second point, range. What was your first point?
So the quality, which is sad and it is congruent to the mood reported by
Okay,
the patient.
congruent. Okay. So someone said, shall not we mention about the appropriateness and the congruence? Okay. Yes. She had started with the congruence also. And see, the grammar is vast. So there is always, you would find some other meaning for appropriateness and other meaning for congruence. So some people say that appropriateness to the mood or appropriateness to the surrounding and congruent to the mood. And with the introduction of the mood congruence and mood incongruent features in a psychiatry in the diagnostic criteria, again, it has become a daily go-away word that if the affect is congruent to the mood or incongruent to the mood. I would go a step ahead than that. Sometimes we can mention whether this mood is congruent to the affect or incongruent to the affect, appropriate to the setting or inappropriate to the setting also we can mention. And in many institutes, mood and affect is assessed after thought. Okay. So here, Hetvi, you have mentioned, and nothing wrong with that. Okay. But in some of the institute, it is mentioned after thought. So it become again useful for them to mention whether is mood is appropriate to the thought or not. Because in a diagnostic criteria, when we say mood congruent psychotic features or mood incongruent psychotic features, so depression with mood congruent psychotic features, so here we check the congruence of the mood with the thought. Here in the criteria, which don't check the congruence with the affect, it is with the thought. So sometimes those people who assess the mood after thought, for them it becomes very easy to mention that whether the mood is congruent with the thoughts or congruent with the thought or not. So even that, so congruent with the affect is one part, in the congruent of the thought is also other part. Second, objective mood and the affect is same, Prashant. They are the similar terminologies. And sometimes the terminologies like euphoric and elated, then dysphoric and depressed is all, there are no parameters to it. Means so much of the depression is dysphoria or so much of the is elation, so much is the euphoria. It's not. It's basically again how we understand those terminologies. So forget about the psychiatry. When you are reading Prashant, any novel, and if you seeing the character was dysphoric, okay, but the second character was very sad. So in a novels also, in the literature also, we talk about the intensity. So dysphoria has a lesser intensity of the sadness, while depress has a higher intensity of the sadness. So when you have a milder type, थोड़ा उदास लगता है, right? थोड़ा सा लगता है, so it could then can satisfy saying by saying that it's a dysphoria. But मुझे बहुत उदास लगता है, that would be a depressed mood or the sadness or mood. So it depends upon the how you understand the grammar or you understand these words. So dysphoria, lesser intensity, depressed mood or sadness is a little higher intensity. Elated and euphoria. Okay, euphoria again higher intensity and the elation is a lesser intensity. Okay, so we will go ahead now with the next aspect. Okay, so affect, appropriateness, congruence, then the range. After that,
So then we can mention about the mobility of the effect, the diurnal variation that we have observed in the effect, the communicability of the effect.
okay, fine, absolutely fine. And if the mobile, how stable it is, okay, if the affect is labile and all these things we can, but very affect one which question is required is regarding the range of the affect, and that you have mentioned. Very nice. So all the participants, are we enjoying this? Because we are left with only 20 yes, I think 25-30 minutes. Are we enjoying it? Shall we go ahead? Okay. Again, the restricted, Vineet, and the constricted, again, the terminologies are there. So if it, again, you can ask me what is the flat affect? Okay. So flat would be about the higher intensity. Then constricted would be in between the flat and the restricted, and then it will be restricted. So flat, constricted, restricted, and then a normal. Okay, so all those things will be there. So now let's go ahead with the MSc after mood and affect.
Yes. Sir, in thought examination, the thought of the patient was continuous, coherent, and relevant. And in when we talk about the stream of thought examination, the patient has bradyphrenia. And in the content of thought examination, sir,
Okay,
uh,
Hetvi, can we go ahead with the one part at a time in a thought? Okay, in a
yes,
thought assessment, the first assessment would be regarding.
so continuity, relevancy, coherency.
No.
As
What would be a heading? Yes, Prachi, please type what would be the heading for the thought assessment? The first heading. Shweta. First heading in the thought assessment. No, Pankaj. Is no. In the thought assessment, we have discussed why did we separate speech from the thought assessment. Okay, stream, absolutely. So let's talk about the stream.
So bradyphrenia, I would like to say
So,
that in examination that is brady.
So now explain under assessment stream of thought. Okay, disorders of stream of a thought. Okay, under that heading, chalo, go ahead.
Sir, in bradyphrenia, basically there is decrease in the number of thoughts, the images, the content, which is decrease like everything per minute, as you would expect in a normal person. In a depressed patient, as we observed in Shruti, it is decreased compared to.
Okay, Hetvi, just assess the stream of thought. Okay, go ahead with your question.
Okay. आप अभी दिन भर आप ज्यादातर क्या करते हैं, आपका रूटीन कैसा रहता है?
घर के काम करेंगे मैडम, और तो क्या ही करेंगे, थोड़ा बहुत मम्मी पापा के पास बैठ लिया, बाकी घर के काम।
Okay,
आप
go ahead.
आप मुझे थोड़ा बता सकते हैं कि जब अकेले बैठते हैं, आप घर पे अकेले रहते हैं, मन में क्या क्या विचार चलते हैं?
अच्छे विचार नहीं चलते हैं मैडम, मतलब अच्छा नहीं लगता है बिल्कुल भी, और अच्छे नहीं चलते, नकारात्मक विचार आते हैं।
Okay, you are in a full role, huh, Shruti? Wonderful. So, see again, stream of a thought. Now, let's go to the question. In the speech, we did mention about the open-ended question. Okay. Now, in the thought assessment, I will tell you about, yes, open-ended question. Number 2, open-ended indirect questions and open-ended direct questions. Okay. So we need to use all these three together, right? So you have used open-ended question for the assessment of stream, and it is perfect for the stream. So now tell me your findings. Or you just wait, Hetvi. Participants are there. Hetvi has asked two open-ended questions to Shruti. Mention your findings in the chat box. Those who have listened, mention your findings in the chat box. Negative thoughts. Ajinkya, okay. Mention your findings under stream of thought. Disorders of stream of thought. Slowness of thinking. Okay. I would take in a stream of thoughts. Slowness of, okay. Interrupted. Then. Okay. So I will guide you. Then you put. Okay. Then you put. So in a stream of a thought, see, in a speech, our concentration is mainly on the speech output. Okay. Mainly our concentration is on a speech output. While in a stream of thought assessment, our concentration should be at thought output. I am using these words specifically so that it would be easy for you to understand. Yes, Mary, retardation, slowed thought process. Absolutely correct. So in a speech assessment, it is speech output. We concentrate on more on a speech output. And in under a category stream of thought, our concentration should be more on a thought output. Okay. So when we say thought output, it would be covered under two areas. One is continuity of the thought and the tempo of a thought. So now in Shruti's answers, let's talk about the continuity of thought. Was there a continuity or was there interruption? Yes, Hetvi, was there a continuity or was there interruption?
So interruption was present in the thought.
Okay. Thoughts were not continuous?
Thoughts were continuous, sir, but in the speech there was mild interruption.
So that would tempo you are saying?
Yes.
So thoughts were continuous. In a stream, they were continuous. Okay. Second, though he said your question was कि, what was your question?
सर आप जब अकेले आप दिन भर में क्या क्या चीजें करते हो, मतलब क्या दिन भर में क्या क्या होता है आपका, एंड द सेकंड वाज मन में अकेले बैठते हो तब विचार क्या चलते?
Ask the same question, Shruti, answer the same. The first question.
जब आप दिन भर रहते हैं घर पे, तब जनरली आप पूरे दिन भर में क्या क्या करते हैं?
घर के काम करते हैं मैडम, और तो थोड़ा टाइम मम्मी पापा के पास बैठ जाते हैं, और बाकी बस दिन भर के काम। और तो
देखो, तो इन हर आंसर श्रुति मेंशन बैठना और घर के काम. Okay. So if you say there were only two thoughts to your questions. Okay. If I ask you, Hitvi, कि दिन भर में आप क्या करते हैं, तो what would be your answer? मैं वार्ड जाती हूँ, पेशेंट देखती हूँ, फिर पीजे एक्टिविटी करती हूँ, फिर दोस्तों के साथ बाहर जाती हूँ, फिर रूम पे जाती हूँ. So many answers are there. But her thinking is, her thought output is slow.
Yes.
He has a slowed thinking. It is continuous but slowed thinking. Or you can use the word poverty of speech is there. Poverty of speech is there. Or you can use alternative one, a retarded speech is there. Reaction time we did mention in a speech assessment, Utkarsh. So here it is a continuous, slowed or retarded thinking with poverty. Okay, see, he is not giving, only two areas were covered, calm or baitna. Otherwise, sentences were there, but there was no content into that. So that's the only thing mentioned. So in a stream, it would be continuous, slowed, oblique retarded, oblique poverty of the speech was there. Fine. चलेगा. So Prachi, you mentioned about thought blocks. Yes, so thought block wasn't there, but yes, if thought block is there, if perseveration is there, if flight of ideas is there, then circumstantiality is there. All these things we can mention in a stream of thought. Even echolalia also we can include here in the stream of the thought disorders. We can include that based upon the situation to situation. So for the to help Prachi understand the thought block, can Shruti you act so that there she will be very clear about the thought block. Prachi, observe the Shruti properly. Hetvi, ask your question. Again, the question would be open-ended, and
Yes.
Shruti answer. Prachi, observe it properly so that a thought block you can never miss again. हाँ, go ahead.
श्रुति, आप मुझे बता सकते हैं कि जब आप अकेले बैठे हैं तब मन में क्या क्या विचार आते हैं, उनमें से कुछ बता सकते हैं मुझे?
जब अकेले बैठते तो मतलब मैडम विचार ऐसे अच्छे तो आपने आप क्या पूछे थे मैडम?
मैंने
Prachi, Prachi, have you observed? So this was a thought block, very well mentioned by shown by Shruti. Very nicely, Shruti, you have done it. So suddenly that question is not there in your mind. Okay, you are blocked. You are blocked with the answer. Okay. Sir, please leave last 5 to 7 minutes for the quiz. Okay, Mansi, whatever possible till that time we will take. Next, let's go for the content. Yes, content of speech.
Sir, in content of thought, ideas of hopelessness, helplessness, and worthlessness are present. Suicidal ideas are present.
Okay.
And sir, there is also preoccupation with worries regarding the somatic complaints she has.
Okay. So because the content of thought is more important, okay, we will talk about in little there, and then we will stop. Okay, we won't take it to cognition and all, and we won't take even a disorders of possession, okay, of thought. We will just cover this. Okay, and so Mansi, we are not discussing form of thought, okay, but for those students who are here, just I am briefing it fast in a form of thought. Everything, okay,
Just
that
need
is
last
there.
5 minutes, sir. Please continue. It's okay. It's okay.
We need to finish by 9, right?
Dr. Sachin can answer that, I think.
Because 10 minutes are left. If she requires 5 minutes for the quiz, then I need to wrap up in 5 minutes.
I think it's okay. You can
So we'll
continue and
extend,
finish
huh.
thought if
Yes.
it's not too long, and then we can take the quiz.
Okay, okay. Thank you,
So
ma'am.
maybe in next 10 minutes if you
Yes,
can.
yes. In a 10 minutes, it will be over. Okay. So now, Hitvi, again ask some question, 1 or 2 questions, and then we will don't jump on a content of thought. Before that, let's consider a form of thought. And it's always a good habit to start with a stream of thought, then form of a thought, and then it depends upon you whether you want to take content of a thought or possession of the thought. Okay. But there is no confusion about stream of thought and the form of thought. They first should be stream of thought, second would be a form of thought. So ask few questions and then we will discuss about the form of thought. 1 or 2 questions to her.
Yes. श्रुति, आपको खाने में क्या क्या अच्छा लगता है?
मैडम, घर का खाना ज्यादा पसंद है और चाट वगैरह कभी खा लेते हैं.
Okay, Shruti, just wait. For all those participants, in a stream of thought, we concentrated more on the thought output. Okay. Now, in the assessment of the for, let's concentrate more on the construction of the words and construction of the sentence. Okay. So form here means formation of the sentence and formation of the words. So normally, when we form the sentences, our words are appropriate with each other, and that's the way we give a meaningful sentence, right? So that is the formation. So concentrate more on the words and the sentences, then we will be able to talk about the pathology of the form. Go ahead with your next question.
श्रुति, आप अभी रिसेंटली कहीं बाहर गए थे तो उसके बारे में थोड़ा बता सकते हैं अगर गए थे तो?
हाँ मैडम अभी घर वालों के साथ मंदिर में दर्शन करने गए थे गांव में। अच्छा था, थोड़ा अच्छा लगता है मंदिर में जाकर भगवान के दर्शन करके। बस बाकी तो उतना ही गए थे अभी।
Okay. Okay, your findings, Hetvi?
Sir, in form, there is no positive
No,
finding.
no,
Like,
no positive. So her sentences are all well preserved, words are well preserved. To be very, very brief, if you are not able, if her speech is, you are not able to understand her sentences, then what is the possibility there could be in a form of thought?
sir, in form, we can, like in patients of psychosis and all, loosening of association,
Yes.
neologism, all that can be included in
Yeah, so
form.
loosening of association, then verbigeration, then clang association, then word salad, then neologism, over inclusiveness. So there is a grade basically in a loosening of association. It would start with the over inclusiveness, then it would go ahead with the verbigeration, then it would go ahead with the word salad, then it would go ahead with the neologism. Then we have a separate with the rhyming words, that's clang association. All these usually we find beautifully in those people who having a bipolar mania as bipolar mania and schizophrenia, even a rapid shifting. Okay, so there also, if they are shifting with the rhyme, then that is a clang association. So all these things we can demonstrate. Can we have some demonstration on loosening of association and flight of idea? Shruti, you may have acted many a times, or I might have demonstrated it many a times. Okay. So one thing, yes, for Prashant, observe it carefully. We are demonstrating flight of ideas. Yes. Okay. But remind you, Prashant, it is not under a form of thought. Flight of ideas is basically a tempo, continuity. It would be under a stream. Okay. So in a manic patient, pressure of speech would be under speech, while a flight of idea would be under stream of a thought. Just demonstrate that.
श्रुति, आप मुझे बता सकते हैं आज दिन भर में आपने सुबह से क्या क्या किया?
आज दिन भर से मैडम सुबह तो मैं उठी थी, तो
Shruti,
सुबह
Shruti,
उठ के
Shruti.
यस सर।
First change your mood. Okay. Flight of idea means you are manic.
हाँ
Okay. Okay. हाँ.
यस
Change your mood. Okay.
हाँ
हाँ. Go ahead.
हेती बोलूं?
Yes.
हाँ,
सुबह उठ के ना मैडम, एक तो मैं बड़ा सुबह जल्दी जल्दी उठ जाती हूँ, और जल्दी उठना ना बहुत अच्छा ये रहता है। मम्मी बोलती है कि जब जल्दी उठ जाते हैं तो सब कुछ ठीक हो जाता है, पॉजिटिविटी लगती है, लाइफ में सब अच्छा लगने लगता है। और लाइफ में अच्छा लगता है ना तो फिर आपका मूड भी अच्छा होता है, सारे काम अच्छे होते हैं। वैसे काम से याद आया, मेरा काम इतना अच्छा चल रहा है मैडम, मैं क्या बताऊँ आपको, सब
Okay.
कुछ ठीक चलता है।
Shruti, you have demonstrated circumstantiality. Okay. So why it happens because see, flight of ideas cannot come without some circumstantiality or without some tangentiality. But flight of ideas would be rapidly shifting from one topic to other. But you were
टॉपिक टू
roaming around one topic and connecting other
topic.
topics. Okay, so that would be
ओके
a
ओके
flight of ideas. So okay, Hitvi, if I ask question, how was your day yesterday, Hitvi? Flight of ideas.
सर, मेरा दिन तो yesterday बहुत अच्छा था। शुरुआत ही कुछ खाने से हुई। पाव भाजी तो मुंबई की भी वैसे बहुत ही अच्छी मिलती है। बारिश तो वगैरह आजकल बहुत ही मौसम चल रहा है खराब। फिर गाड़ी भी चलती ही रहती है, इतने सारे एक्सीडेंट्स होने लगे हैं। एक्सीडेंट आजकल सुसाइड के भी रेट बहुत ही बढ़ गए हैं। सब काम वाम हमेशा करते रहते
Okay,
हैं।
Hetvi, hold on. So I understood that Hetvi is speaking about Mumbai, जहाँ पे खाने को rain और accident है. That I understood. And she is rapidly shifting from one topic to another topic. So in a flight of ideas, there is a rapid shift from one topic to another, and we can write it properly in a sequence also, so we can understand. So comprehension is there in a flight of idea. Now let's demonstrate, because so many people have asked loosening of association. Okay. So ask question. Shruti को question पूछो and she will loosening of association.
श्रुति, आज अपने खाने में क्या क्या खाया?
खाने में तो मैम रोटी सब्जी खाई थी, और सुबह में मम्मी आई थी, मम्मी कुछ बता रही थी घर पे, कुछ तो प्रॉब्लम हो गया था। अरे वो क्या, वो मैंने किधर किताब रखी थी, मुझे कुछ याद भी नहीं आ रहा है। और मुझे पानी भरने भी कैसे बाहर जाना था। और सब यहाँ आपके स्टाफ बहुत अच्छे हैं मैडम, आपके वार्ड के।
हम्म।
और लेकिन यहाँ काम वाम कुछ नहीं रहता मुझे।
Yes, good, Shruti, good. So it is very difficult, Prashant, to take out the meaning out of the speech sample of the Shruti. So she is losing association between the sentences. Vinith, derailment. See, loosening would come with some problems in the form of thought. Okay. So derailment means you are derailing from one sentence. So you are not able to finish that sentence and then you are derailing. There's a derailment of a train. Similarly, derailment of the thoughts. So under umbrella of the loosening of association, you can find many problems, or you can say under irrelevance of the stream of thought also you can find very. So there could be a derailment, then there could be some verbigeration, then word salad, there could be neologism. All these could be there. So taking all this together, if you use the word loosening of association also, there shouldn't be a problem. Definition wise, though they are different, but they come together many a times. The person having loosening of association, not having derailment is very difficult. Okay, because he would derail from the thought process. So rapidly, as Shilpa madam has given us few more minutes, last 2-3 minutes are there. Content, you have mentioned about the content of the Shruti, and I just want you to ask the very specific question. Okay, so what did you say about the content analysis?
Sir, I said there are ideas of helplessness, hopelessness, and worthlessness that are present.
Okay. So put your questions properly. If they are correct, we will go ahead. Yes, put your questions for this content.
श्रुति, मैंने आपसे जब विचार के बारे में पूछा था, आपने मुझे बताया था बहुत नकारात्मक विचार आते हैं। आप मुझे कौन से विचार आते हैं उसके बारे में थोड़ा और बता पाएंगे?
मैडम, ऐसा लगता ही नहीं कि अब मैं ठीक हो सकती हूँ या आगे कुछ हो सकता है। तो फिर ऐसा लगता है जीने का क्या मतलब है, क्यों जिए हम इस तरीके से बीमारी में जीने से। मुझे नहीं लगता कि मैं कुछ भी आप कर लो मैं ठीक हो पाऊंगी। दवाइयाँ आप जितनी भी दे लो, मुझे नहीं लगता कि कुछ हो सकता है अब।
सर, शुड आई कंटिन्यू?
Yes, continue with this. हाँ.
आपने बताया जैसे कि जीने की भी इच्छा नहीं होती है, तो आपको ये विचार कितनी बार ऐसे दिन में आते हैं?
मैडम, ज्यादा में ज्यादा तो ये विचार मन में रहते ही है मेरे, कुछ ना कुछ, क्योंकि किसी भी चीज में मन नहीं लगता है तो फिर ऐसे जीने का क्या मतलब।
तो ये विचार रहते हैं, पर साथ में कभी ऐसा हुआ है कि आपने कुछ सोच लिया है कि मैं ऐसे
Okay,
कर
Hetty, I'll interrupt you here. So
Yeah.
again, in the beginning, I told you in a speech we ask open-ended. In a thought assessment, many a times we need to ask open-ended indirect questions. So Hetty's question was open-ended indirect question. And sometimes, if suppose the person is not cooperative for assessment, we need to ask sometimes open-ended direct question, but it would come under that flow. So here, Hetty, you can connect. She said कि कोई hope नहीं है. Okay. So
Yes.
कोई hope नहीं है, तो next question would be for your helplessness, right?
Yes.
तो you could have asked, अरे नहीं दे, we are all there, है ना, आपके घर के लोग हैं जो आपको help कर सकते हैं. So that should be your the second question, okay? And then would be your third question. So it goes in that, because severity is such, okay, hopelessness, helplessness, and worthlessness, that is there. So right questions. So what was your question when you asked for her? What was your question?
So she had mentioned about nakaratmak vichar before, so I
What was
asked
your, हाँ, yes, your
her
question.
कि आप मुझे आपके नकारात्मक विचार के बारे में थोड़ा और बता सकते हैं क्या?
Yes, so okay, और the right question would be okay, आपको क्या लगता है, okay, आपके ये आप इस प्रॉब्लम में हो, है ना, आगे में आप इसके बारे में क्या सोचते हैं? Okay, so that would be a very right question for assessment of the hope. Okay, when she says something, the next question would be, we are there, your family members are there, don't you feel you will be out of this. That would be
Yes.
question for helplessness. And
Helpless.
third
Yes.
question would be for the worthlessness, which was very right. Okay. So
Yes.
this should go in that flow. Okay. Now the
Yes.
question for the suicidal ideas. Okay. You said suicidal ideas plus. So what was your question? Demonstrate that. And then we will stop. Sri Lakshmi will stop after this. Okay. Huh? Suicidal ideas.
So because she mentioned about the death wish in her initial question only, I would like to ask her further about that only.
Yes.
सो आपने श्रुति बताया कि ये ऐसे कुछ नकारात्मक विचार पूरे दिन भी रहते हैं, तो ये विचार पे कभी आपने अमल करने का सोचा है या कभी कोशिश की है ऐसी जो पहले कभी आपको कुछ हानि पहुंचा सकते हैं?
अभी तक कोशिश तो की नहीं है मैडम, लेकिन जैसे जैसे दिन आगे बढ़ रहे हैं वैसे वैसे ये मजबूत होते जा रहे हैं विचार। अभी हम 2-4 दिन बाद ही मेरे मम्मी पापा मुझे नानी के घर लेकर जा रहे हैं ताकि माहौल बदलेगा, तो हम ट्रेन से जाएंगे। तो ऐसा लगता है कि किसी को बिना बताए जब जाएंगे, बस ट्रेन के सामने कूद जाओ, शायद कोई बचा भी नहीं पाएगा तो बेहतर रहेगा, सब खत्म हो सकता है फिर। टीवी में भी वही अपन देखते हैं, ऐसा सोचा है।
Okay. Okay.
So sir, in this sorry.
Go ahead. Go ahead. What are your
Uh,
planning?
Sir, in this examination, along with the ideas of hopelessness, helplessness, worthlessness, there is suicidal ideations that are present. And sir, planning also has started for the patient, but there are no previous suicidal attempts for the patient.
Okay. So you ask the question maybe 2 minutes prior that how often you get those thoughts in a day. Okay. So
Yes,
that
sir.
was a very right question to assess the severity of suicidal ideas. And
Yes.
so along with the suicidal ideas severity, we need to ask about the planning.
Plan.
Okay. So intent and plans. Okay. So you ask about the intent and the plans. So she has getting those plans in her mind. Okay.
Yes.
In few days she is traveling, so she is getting those plans in her mind. And when we say all these things verbatim in the mental status examination, it becomes more realistic and
Yes.
very helpful for us. So we have approached 9-4, and I think it's not good to wait Mansi for her quiz. We will stop here and give an opportunity. We have just covered a half part. Okay, I would say a 40% of the mental status examination here, because we have demonstrated it. Okay, and so it has taken more time. Otherwise, if we would have done it in a PowerPoint presentation, we would have able to finish it. But demonstration do take time. So we are left with the disorders of possession of thoughts and then entire cognitive assessment. So sometimes later, whenever we meet for the PG programs, that time we will continue with this in the next part. So thank you so much, Shruti. You were perfect
Thank
in
you,
your
sir.
acting. Thank you so much, Hetvi, for being so polite with me and polite with your patient. And thank you so much, Shilpa madam, Sri Lakshmi, Sachin, Mansi, and Parag sir, for giving this opportunity to take this session for the postgraduate. Thank you so much.
Thank you, sir.
Thank you, Sushil.
Thank you.
It was
Yeah, thank
wonderful.
you so much.
For elaborate session and as per the
I think
responses, there was
Dr.
it was
Parag
a
was
very
saying something.
interactive sessions. And this topic was actually taken from the feedback form.
Yes, Dr. Sachin, please continue.
So, sir, this topic was actually chosen from the feedback we usually get from the participants. Many participants suggested that there should be a mental status examination topic. So we had a good number of participants. Today we had around 121 participants, and all were responding well. I will also request all the participants to give their feedback so that we can improvise further and we can on the topics of their interest. so that it will be a good learning opportunity for the participants.
Thank you. Thank you so much. A few words from my side. I'm so delighted and so happy to see such a hard work and so much of preparations and active involvement from the three resource persons that we had. Dr. Sushil, we are very happy to have you listen to you and coordinate the whole session. And Dr. Shruti and Dr. Hetvi, we are very happy to see you today. And in fact, our expectations from both of you have increased much more to see you more and more in the coming sessions. It's a pleasure
Thank you
for
so
all the
much.
teachers to learn and interact from all of our students. And I'm sure all the students from the West Zone Psychiatric Society today had a lot of insights into the basics of psychiatry. As psychiatrists, as psychiatry department, we do have academic sessions and we do have a work pattern and kind of protocols that we follow within the department, but it's very, very enriching and broadening our views to see how it works in other departments, other colleges, other parts of the state and country. So I'm sure all the PG students would have gained much more insights from today's session than what they already knew. And it would definitely help them to become better psychiatrists and also to perform well in the forthcoming exams. My best wishes to both of you, Dr. Shruti, Dr. Hetvi, and all the
Thank you
PG
so much,
students who have
sir.
attended today's program. Thank you so much. Dr. Shilpa ma'am, your words?
Thank you, Dr. Shah. I think you kind of said it in few words, everything that had to be said. Thank you, Dr. Sushil
Thank
and
you.
Dr. Shruti and Dr. Hetvi for that wonderful performance. I think
you.
a lot of preparation has gone in that. And as I had suggested to Dr. Sushil, he didn't stick to any formats or anything like a one after the other or something. It was just the skill that we learned today, how to ask, what questions to ask, and what kind of responses you get, and from that, what cues to take, and what next question should be asked. So that is what is expected actually when we ask you to elicit or when we ask you to examine something, any heading under mental status examination. And I hope that point was reached to all the postgraduate students, 120 who attended. So thank you, Dr. Shah, thank you, Dr. Sushil, and thank you, everyone.
Thank you, ma'am. Thank you.
Sachin, if you have to add anything about the feedback.
Yes, I have just shared the link. I will request all the
okay.
participants to
They
fill
will-
that feedback form. And over to Dr. Mansi
Mansi.
for as we
Before
have
the quiz starts, just a word. If I'm sure we'll try to accommodate another session to have the remaining part. But if that is not possible in this half, if sir would be willing, we can even just do a video recording for the remaining and add it on, because this goes on the West Zone website, all the links of these things.
Yeah.
So maybe if sir would be willing, he can, with the two of them, do the demonstration for the remaining part, and we can add it on as a video along with this. So it's kind of complete for anybody who wants to refer the repository.
Yes, yes, absolutely, Srilakshmi. We will do that.
Thank you, sir.
Thank you.
Yes.
Thank you.
Mansi, over to you.
Okay, so it was a wonderful program and we'll not keep everyone waiting for long. So, on behalf of the IPS West Zone Quiz Committee, we are here, Prerna and myself, and we've started having small kind of quizzes at the end of these teaching programs. So since this is our first one, we have a small questionnaire. It's going to be in the form of Zoom poll. So they'll start displaying the questions. There are 10 questions. All 10 questions will be displayed together. You select the answers and then you go to the next question. And at the end of the answering of 10 questions, press submit. Don't press submit in the middle of after each question. So just answer all the 10 questions together and then you press submit, and then we'll calculate the results and maybe disclose at the next meeting. You'll get approximately 5 to 10 minutes to solve the quiz, and I think we can display the questions now. Yogendra ji, please start the
Yes,
quiz.
yes, ma'am. Can you see it?
If you can't see it, please put it in the chat box or speak up, please.
You can scroll down, all the questions you can see.
I think a few more minutes, next 2 to 3 minutes, and then we will wrap up because I think almost most of the people have answered and have left. So 2 more minutes. I hope everyone's finished answering and has pressed submit. If somebody needs more time, just put it up, but I think this was sufficient time. All right, so we'll end the poll. So
Right.
Yogendraji, please
Yeah,
end the
yes,
poll.
ma'am, I will.
Yes.
Total 47 has been answered out of 50 is mine.
Okay, fine. All right.
Can I
Fine.
share the result?
Yeah, wait, you can do that later. I'll have to calculate them. You can share the answers. So the first question, the correct answer was diagnosis. Mental status examination does not include diagnosis. When performing MSc, when you are asking to spell the any spelling backwards, we are usually testing for attention. The condition where complex visual hallucinations occur in the absence of psychopathology and clear consciousness, we were looking for Charles Bonnet syndrome. Flight of ideas, we learned that it's a disorder of stream. During examination, when a patient says that he need not answer because everyone else understands and knows what he is thinking, this is thought broadcast. So this is an example, question 6, where patient admitted expresses that he hears voice every time the ward phone rings. It's a functional hallucination. The trick here was whether it's a type of reflex hallucination or functional hallucination. The definition of functional hallucination is both the stimulus and the sensory,
Keep it inside.
hallucination, both are heard together. So that's why it's a functional hallucination. This was a very factual question, talking past the point, Voiberderin. So this was again something we learned today. The mood was inappropriate to the surroundings and it was incongruent to the mood mentioned, and hence the answer is mood was incongruent and inappropriate. Belief that he is no longer having a brain, it's delusion of nihilism and not a somatic delusion. Again, it was a trick question. And lastly, when we are asking the difference between an apple and orange, we are looking for concepts. This maybe will be covered in the next part of the MSc. So we'll calculate the answers and tabulate them and then probably discuss them in the next Tuesday meeting. Thank you. Dr. Sachin, over to you.
Thank you, Mansi ma'am. Now, should we wrap up the session?
Yes, please.
So, thank you, Sushil Gawande sir, for elaborate insight-oriented discussion over the mental status examination. Thank you to the Parag Shah sir for being here and sharing their few words. So, over to you, ma'am.
So we can conclude this. I'm sure this was also, as you said, giving insight into how much we know about MSc and how to do MSc, both of it. And
We've
a lot of
already got
learning.
a lot of feedback asking for please do the remaining part. Please have a session with the
Yeah.
remaining part. So
So
we'll work out
plan
for the
sometime.
videos. Sir.
Yes.
Yeah.
Or if we can accommodate it sometime, otherwise video is the answer. So thank you, Dr. Sushil.
Thanks, ma'am.
It was a wonderful session and the feedback says it all. So I don't think I need to say much. I hope we can plan another session. Otherwise, we'll request you to have a video and then we can put it on the website.
Yes, ma'am. Absolutely.
Thank you so much.
Madam, today's session video will be available tomorrow.